All right, I'll start. Today we will be tackling the question, is telehealth the right choice? You will hear viewpoints that support the use of telehealth and viewpoints that disagree with telehealth. This presentation will explain telehealth, ethics, and explore various topics related to telehealth, such as individuals' effectiveness of service delivery, access to services, and ethical considerations. You will gain knowledge on both sides of the telehealth debate to determine if telehealth is the right choice. In order to fully understand the point of view of each side of the debate, it is essential to understand telehealth and ethics. Telemedicine is a technology-based alternative to traditional healthcare delivery. According to Bolk's 2020, telehealth uses video conferencing for therapy, evaluations, and medication management, and is sometimes used to supplement in-person treatments. Telehealth has increased in popularity within the past 5 years due to the COVID-19 pandemic, which has increased the research on the topic. According to Contreras 2021, the role of professional ethics is to protect individuals. Ethics are intended to serve as a guide for professionals. As a BCBA, behavioral analysts follow the BACB Code of Ethics, which provides a means for behavior analysts to evaluate their own behavior and for others to assess whether a behavior analyst has violated their ethical obligations. The code applies to behavior analysts in all of their professional activities, including direct service delivery, consultation, supervision, training, management, editorial and peer review activities, research, and any other activity within the ABA profession. The code applies to the professional activities of behavior analysts across various settings and delivery modes. When using telehealth, professionals need to consider ethics when providing services to clients. This debate will focus on elaborating on ethical considerations in the field of ABA and the use of telehealth. Due to the increased use of telehealth since the 2020 pandemic, there has also been a corresponding rise in research. Research has explored effectiveness of telehealth among clients, including evidence-based strategies, the effectiveness of interventions, the quality of care, rapport with clinicians, and the building of trust between the clinician and the clients. You will hear about research that considers how telehealth may influence the quality of care, effectiveness of supports, environmental, operational, and technological factors, and private policies.
All right. Thank you, Haley. That was really good. My name is Joshua. I'm speaking on the effectiveness. Um, so Harvard Business Review studied that 19% improvement in medication adherence among patients using telehealth platforms. And this is more like when it comes to like access, that's what it's like focusing on. That's what people are communicating that they like or agree with, because an example that I could use would be if I'm sick at home and I can't reach my doctor, or I can't go to the clinic, or let's say I'm not sick, but I'm mentally unwell and I just don't want to be in the public. Uh, Telehealth would be more adherent for me. And in this slide, I also noted that there was a time period, I know probably everyone here remembers, it was COVID-19. Um, One of the biggest pandemics I've ever faced. And there's a lot of people that have stories that basically state that they felt like alone in the time being. And so there was a rise in mental health. And the CDC observed that there was a 300% increase in telehealth mental health visits. So this is highlighting its capability and critical role in maintaining access to behavioral health services, especially during crisis. So this also goes hand in hand with what I just said. Telehealth continues to demonstrate its value in enhancing patient satisfaction and engagement. 2023 survey by JD Powers found that 80% of patients were satisfied with telehealth visits, citing convenience, shorter wait times, and more relaxed experience as key benefits. This trend strengthened in 2024. Telehealth satisfaction study revealed that convenience of 65% and speeds of access to 46%, and it remains the top reasons why patients choose telehealth through satisfaction.
So, as we had already touched on a little bit from what Josh had said, which I'm also Lily, by the way, and I'm also going to be on the pro side for telehealth. We had said that numerous studies have shown that telehealth ABA services have been shown to be effective in diminishing target behaviors as well as increasing socially significant skills. As you can see here, a study by Nohaldi and colleagues examined the effects of providing natural environment teaching as well as discrete trial training through a telehealth. They looked at acquisition of skills in three different domains. It was language, adaptive skills, as well as social skills. And the participants in this study were seven children that were diagnosed with ASD with differing support needs. They ranged in ages from 4 to 16 years old. And these sessions were directed by a behavior technician. However, a caregiver was required to be present in the home for services and provide support as deemed necessary. So in this study, they actually had three different levels of caregiver support that they examined. So those would be technician delivered telehealth, caregiver assisted telehealth, as well as caregiver implemented telehealth. And in this study, it showed that all participants met mastery criteria for skills, and they maintained that mastery criteria when the post-treatment data was obtained. And they had also found that six of the seven participants only needed minimal caregiver support in the delivery of services. So these findings provide a lot of support for the effectiveness of telehealth treatment for individuals diagnosed with autism spectrum disorder, as well as those with varying support needs. And they also had cited in this that telehealth is having a lot of utility in being able to maximize the continuity of care, which was also touched on by Josh. And although that was a very big focus during the COVID-19 pandemic, there actually has been kind of a halt in research on that, and I haven't been able to find as much on that as you would expect now. Another study that we had examined was looking at the increasing of generalization of skills by allowing practitioners to increase or to access behavior change agents, materials, and contexts they may not have direct contact with when they perform services within a clinical or classroom setting. And this article also expanded on the varying generalization strategies that were introduced by Stokes and Bear, proposing that their application can be used in telehealth. And some of these strategies were training loosely, programming common stimuli, and using discriminable contingencies. And they also included a case study in which there was an individual who was a 17-year-old male diagnosed with Down syndrome, as well as other disorders. And they had shown how these strategies can be used to reduce challenging behaviors. They also found that the intervention components in the case study included a functional analysis, providing caregiver training, as well as implementing a behavior intervention plan using FCT, extinction procedures, as well as maintenance of skills, or I'm sorry, as well as multiple schedules of reinforcement. And the study reveals that there was high reductions in challenging behavior, maintenance of skills across quarterly follow-ups, as well as high scores of social validity. So in that, you can see right here, this was actually the data points for the only participant that required the highest level of support. So as you can see, it was very effective still, even with that additional support being needed. And the two ethical codes that I found were most applicable to this would be Standard 201, providing effective treatment, as it states that professionals should prioritize client rights and aim to maximize benefits by providing services that are consistent with behavioral principles and show existing scientific evidence. And in Standard 3.14, it states that behavior analysts should aim to minimize disruptions to services. So this along goes with that continuity of services, and providers should take steps to prevent interruptions and make appropriate decisions to resolve these interruptions when they do arise. So those do provide some evidence as this would be an effective treatment option.
Hey guys, my name is Jovan, and I'll be going over this part. So, when it comes to trust issues with security, there's many vulnerable populations that lack private spaces to share sensitive health information during telehealth sessions, leading to discomfort and reduced trust in the process. For example, for the elderly, adolescents, or even those that are homeless. Um, how do I move the slide? Okay, there. And there's also technological factors, operational factors. So for technological factors, limited digital literacy and poor internet access can make it difficult for some clients to trust the reliability and privacy of telehealth platforms. And for operational factors, inconsistent training and unclear workflows around telehealth reduce confidence in services and data protection, creating barriers to building trust with clients. Um, next one. And also, there's a lot of client concerns. For example, when it comes to environmental concerns, clients may fear being overheard or exposed during sessions due to shared or non-private living conditions. There's also technological concerns. For example, there could be data breaches, poor video audio quality, unfamiliar platforms. These concerns have clients question telehealth safety and effectiveness. There's also operational concerns, which um, lack of provider training and unclear communication about privacy policies can contribute to mistrust, especially when handling sensitive information or sensitive topics.
Telehealth is used as a virtual platform to provide services to clients. There are various viewpoints on telehealth to consider. Some views support the use of telehealth, while others disagree with it. One factor that is appealing to others and has supporting evidence is that telehealth enables increased access across different populations, regardless of economic status or busy lifestyle barriers. On the contrary, telehealth can raise concerns such as accessibility to technological resources and licensing restrictions that may impact the ability to provide adequate support. Both sides will discuss the ethical decisions related to accessibility about the BACB codes of ethics and ethics towards client care.
So overall, it has been found that greater geographic access and provider access has been shown to increase overall utilization of services as well as result in improved health outcomes. Furthermore, among children that are diagnosed with autism spectrum disorder, their diagnosis has been obtained earlier by those that live in an area that has a medical school or a large number of diagnosing professionals, such as psychiatrists or neurologists. So to further understand the geographic distribution of BACB certificates, descriptive statistics from the BACB certification board were examined from the years between 1999 and 2019. This revealed a trend of a higher number of certified BCBAs in states with a larger population size. Researchers Yingling and colleagues aim to assess the relationship between geographic access to ABA practitioners and sociodemographic variables. And they looked at the county level by examining public data from the U.S. Department of Education's Civil Rights Data Collection, which is also known as the CRDC, and the BACB. Through this examination, they found that there was highly affluent areas and urban areas that had the most access to BCBAs at the county-wide level. And another integral finding that they had was that among the U.S. counties in the sample, over half had no practicing BCBA in their county. So this emphasizes the need for increased services and increased accessibility to these services. And it may hold utility to use telehealth as a mediating delivery format. And then in terms of cost effectiveness of services, a 2016 study had provided support for telehealth as a more cost-effective alternative to traditional home and clinic-based therapy models. The study was conducted by Lindgren and colleagues, and it compared the outcomes and costs of training parents to complete functional analyses, as well as teach functional communication through 3 different models. These models were in-home therapy, clinic-based telehealth, home-based telehealth. In each group, the parents received an initial in-person training by a BCBA on implementing the FA and FCT procedures. And after this step was complete, the practitioners continued to provide weekly coaching to the parents on these procedures through the assigned delivery format. So the data obtained from the 94 children with autism that completed the study showed that a 90% reduction was shown in target behavior across all service delivery models. There also was, when examining the staff costs, they had found that facility costs and family costs from both telehealth models were found to be significantly less expensive to implement. And they found that telehealth in-home was costing the least to utilize on a weekly basis. So in terms of the ethical obligations, I found that there was multiple that were outlined in the BACB ethics code that behavior analysts must adhere to increase accessibility of behavior analytics services. But two of the ones that stood out to me was the core principle of benefiting others. The basis of this is that BCBAs should maximize the benefits to their clients as well as minimize harm. The second one that I found was standard 1.08 non-discrimination. And this includes providing inclusive and equitable services. And this also elaborates on the fact that BCBAs do have the obligation to identify and overcome barriers to service delivery. So again, by being able to provide telehealth, that may provide utility for individuals who may not be able to either afford to get those services, travel to those services, or just may not have the access to be able to have a BCBA in their area.
All right, I'm Austin. I'm going to be covering the barriers to accessibility. Telehealth undoubtedly can improve access. That's what it was created for, but there are still many barriers limiting access. In 2012, Tracy A. Lustig, working with the Board of Healthcare Services, conducted a review on the role of telehealth in an evolving healthcare system and identified a number of challenges related to telehealth. Primarily when it comes to access, there are licensing and regulation barriers, discrepancies when it comes to broadband connectivity, and limitations to financing. Next slide, please. All right. When we're discussing licensing and regulation discrepancies, Lustig goes in depth on these licensing issues. And the primary concern is interstate licensure and how they may not be able to practice between state lines. In 2012, Lustig identified 12 states with less than 2,000 specialists involved in telehealth, and 11 states with less than 11 specialists per 10,000 population. This highlights how services may be limited when service providers are a limited resource themselves. Many state medical boards also require previous in-person consultation as well. This image I have here gives us a breakdown of specific licensing required to practice between states. The purple states, for example, allow for exceptions to licensure as long as they are consultations or follow-ups with the patient temporarily located outside the jurisdiction of their primary practitioner. The white states require full state licenses with limited or no exceptions. The orange states require a telemedicine license to practice, and the blue states require a registration or a waiver to practice, while the light blue limits this to certain practitioners only. Green states participate in a regional reciprocity, which allows out-of-state providers to offer telehealth services under certain conditions. Next slide. Broadband connectivity issues. There are issues when it comes to rural and underserved communities. There's simply just not the infrastructure in place to provide accessibility to these areas. The National Association of Counties conducted a study to show internet connectivity across the United States. This image above shows broadband connectivity with roughly 65% of counties tested falling below the federal broadband standards. High-speed cellular services remains a challenge for these counties of all sizes as well. And the image below shows areas where connectivity simply does not exist, as the infrastructure does not exist to cover the whole of the United States. Next slide. And the last issue to accessibility is finances. Simply put, Insurance does not want to pay if they don't see a need for it. Lustig, 2012, cites the Social Security Act, Section 1834M, which limits the use of telemedicine to certain providers and restricts the delivery of telehealth services to certain rural areas of the country. Now, in good faith, I know Josh mentioned COVID-19 earlier, and the CARES Act played a significant role in expanding access to telehealth services during the COVID-19 pandemic by removing previous limitations. However, there are still ongoing discussions and potential future policy changes that could impact the future of telehealth coverage. Lustig also states greed as a barrier to access, as technology is being produced by people who are attracted to the potential market of telehealth. And lastly, even if insurance does pay and a company offering telehealth practices ethically and affordably, there are still out-of-pocket expenses required to even initiate the process. Like a computer with a webcam, software, a reliable internet connection are all among the few examples that would not be reimbursed, making access out of reach for the underserved communities. Next slide.
The Ethics Code for Behavior Analysts guide the professional activities of behavior analysts. The code applies ethical guidelines to the professional activities across settings and delivery modes. Some research regarding telehealth is centralized around the issue of ethical compliance and maintaining confidentiality when providing appropriate services to clients. When considering telehealth supports, it is vital to consider HIPAA, FERPA, consent, assent, and ethical considerations to ensure safety and professional treatment to clients.
Thank you, Haley. Before I start, I just wanted to touch on what Alex said. I feel like you missed one thing. You said it's going to require a computer and internet, but you're also able to do telehealth through your phone and just having phone services. Now I'm going to touch up on ethical compliance in telehealth. First off, I just want to say telehealth must adhere. It's law. It is law. Telehealth must adhere to a strict ethical guideline to ensure patients' confidentiality, informed consents, and equitable access. The board Analyst Certification Board has established specific standards for telehealth and ABA, recognizing its effectiveness when implemented ethically. And some of the key points I wanted to note was the confidentiality and the HIPAA compliance. Telehealth just doesn't use random apps. It uses secure apps like Zoom, WebEx with encrypted video calls, and that it just must be protected for patients' data. Informed consents. So it's not whether or not if you don't want to use, you're not forced to use telehealth. Patients is usually they're understood. They understand that there's limitations and that there's also benefits to telehealth. Equitable access. Providers must ensure clients have necessary technology and skills to participate. So some of the requirements are like everyday things that we have around, like our phones. It's not just laptop and internet. It's also phone and cellular service. Competency-based care. Clinicals must be trained in telehealth delivery methods. Clinicians, must be trained in telehealth delivery methods. The BACB's 2023 telehealth reported that 75% of BCBAs reported successful outcomes using telehealth, particularly for parents training and supervision. Ethical compliance. I know Liddy mentioned some. These are just some additional ones I wanted to mention. For the BACB ethical standards of telehealth is 2.09. Behavior analysts must ensure technology is appropriate and secure. 3.03, consent of telehealth. Like I was mentioning earlier, clients must be informed of potential risk and technical difficulties. 4.07, Using confidential information, data must be protected per HIPAA and state law, as in if a BCBA violates uh, individuality, they will be held accountable. Evidence. 2021 study in behavior analysis and practice found that telehealth delivered ABA just as effective as in-person therapy for skills acquisition in children with autism. Now, we all work ABA. It's so important when it comes to our kiddos that I don't know if you guys ever had a session where you brought a kid into a doctor's appointment where you went with them. Sometimes it could be rough. It could be hard for the parent. And just the fact that telehealth just opens up a door and allows them to get what their child needs within the safe walls of their home is super important for me. Next slide, please. Ensuring patients' confidentiality. Telehealth providers prioritize their privacy of patients by utilizing secure and encrypted technologies. Main advantage is HIPAA-compliant platforms such as Zoom, Healthcare, and Doxy.me facilitate communication that is both legally compliant and focused on privacy. End-to-end encryption secures personal health information during online sessions. They have a safe data storage protected by passwords, encryptions, and they keep medical records secure. Cybersecurity trainings prepare staff to recognize common risk and uphold professional standards. All this is saying basically it is just as good online as it is in person. I know we all have a company that we work for, and we all know how important it is to keep data safe and secure. And telehealth, I just wanted to explain that telehealth has quite the same standards just online. So in conclusion for this slide is that security is a priority in telehealth. And telehealth works closely with caregivers, fostering patients' trust and reinforce the ethical foundations of contemporary healthcare.
Jovan again. So ethical considerations. So just because a BCBA or RBT is skilled in delivering services in person doesn't automatically mean they're equipped to do so remotely. Providing behavior services through telehealth requires a completely different skill set. You're no longer able to physically prompt or even model some strategies or manage behaviors in the moment. That means you're relying entirely on vocal verbal behavior, which may be sufficient for all learners or caregivers. For example, if a client begins engaging in severe problem behavior like self-injury or aggression, you can't just step in and model a de-escalation procedure. You may have to give instructions through a screen, often during high stress moments, and hope the parent or RBT on the other side can implement it accurately, appropriately. Um, that's not just risky; it's potentially unethical. The practitioner hasn't been trained for remote coaching. As future BCBAs, we're all bound by the BCB ethics code to operate within our scope of competence. If we're not trained in remote services, or we're not confident managing high risk behavior from a distance, we shouldn't be providing the services through telehealth. Next slide, please. Um, also, there's confidentiality, which is a major ethical concern in ABA telehealth. So using so for example, it could be HIPAA or FERPA um violation um because of the tech that we're using. We have a responsibility to protect client data at all times, and that includes selecting appropriate secure systems for virtual service delivery. But it's not just about the software, it's also about the environment. If a client is doing their session in a shared space like a kitchen or living room, anyone in the home could overhear sensitive information. So if a friend is visiting and their session going on at the same time, they could potentially overhear sensitive information. Even if the platform seems secure, privacy can still be compromised due to lack of environmental control, like I just stated. And and um, like as clinicians, we're as future BCBAs, we're obligated to inform families of all these risks before they agree to services. They need to know how sessions will be conducted or what could compromise privacy and what their options are. If we decide to skip that step, we're not practicing ethically. Next slide, please. Um, One of the biggest mistakes we can make is assuming that telehealth is a one size fits all model, which is not. These A lot of a client who needs simply cannot be met remotely. Um, there are a lot of clients whose needs can't be met remotely. Sorry. Um, these individuals who engage in automatically maintained or very dangerous like behaviors, for example, eloping, self-injury, or even aggression. Without in-person support, it's almost impossible to ensure safety or accurately implement certain interventions. And even for clients who don't engage in high-risk behaviors, telehealth can limit or our ability to observe behavior in context, ensure procedural fidelity, and respond to moment or and respond in the moment behavioral contingencies. These are very important components of ABA. If we can't access that data or support the behavior change process in real time, our interventions become way less effective or even contradicted. That reversing back to the ethics code again, it makes it clear we have a duty to recommend alternative services or to continue telehealth when the risks outweigh the benefits, which could be high in many cases. And in some cases, that might mean recommending in-person sessions, um, in-person parent trainings, caregiver trainings, or consultation-based services instead. Um, so yeah, next slide. Oh, that's it.
Thank you for listening and hearing both sides of our telehealth debate. Today, you have heard that telehealth has increased since the 2020 pandemic, which has increased the research and curiosity and knowledge and the use of the topic. The use of telehealth provides a wide range of points of view with strong arguments for the advantages and disadvantages of telehealth. Some of the various main points to consider when utilizing telehealth are access to care, effectiveness and quality of care, licensing credentials, trust and rapport with clinicians, and ethical guidelines regarding confidentiality, competence, and compliance to ensure safety and professional services to all clients. As BCBAs, it is crucial that we weigh the ethical considerations if we choose to use telehealth in our modes of service delivery. You just heard both sides of the debate regarding telehealth. Please refer to the questions below and references that were addressed throughout the debate. This research will help provide insight into telehealth and the advantages, negatives, and considerations. We will give you a moment to read through the questions. And then the last section of our debate is the references and the research that we used to provide this debate for you.